So we are really happy to have you guys. I'm Suanne Jackson. I think we'll go ahead and get started. I'm Suanne Jackson. I'm with the WLLO folks, and I am the volunteer team leader. And we are all sharing activities at this point. And we were meeting with the volunteer or the program affinity group with all the villages, and Paige reached out to us. She's from the university. She's from Pacific University. And we are so excited to have her today. So I'm not really going to say much more. I'm just going to let Paige take over, tell you who she is and why she's here. And again, thanks to you guys for coming today.
Yeah, thank you all for having me. So I'm Paige. I'm a PhD student studying clinical psychology at Pacific University. So I would say, local, but also it doesn't even have to be local at this point. We can reach so many people. And so it's really, really great to be working with you all. I'm really passionate about psychoeducation and helping get the science of psychology out there because, where else do you find it? But actually, before we started this, there were only a couple people. We were talking about book recommendations. And on the topic of brain health, I wasn't going to do this before, but now I'm going to recommend this book that I started reading called Brain Rules.
And we put that in the chat.
Yes. They might not have access to it if they jumped in late, but okay. I'm not sure.
Okay.
But the presentation is not based off of this. This is just a great book about brain health and wellness by John Medina. So today I just have prepared a presentation on brain health and wellness. So it's pretty broad. I'll talk about a couple different things. I want to introduce you to cognition and aging and hopefully ease some anxiety that comes up for a lot of people around aging and cognitive health. And then talk about some evidence-based ways to improve your brain health. So it's a lot. There's a big thing about having a healthy heart, right? But you can do that with your brain too, and that can help prevent cognitive decline. Before I jump in, the topics might move a little bit quickly, or topics might switch around. So I do encourage you to just interrupt me in case I can't see your face. If you're trying to flag me down, just interrupt me and let me know if you have any questions. I'll try to check in too. Okay. All right. Can you see this slide okay? Looking at a big colorful brain?
Yes.
Yeah, okay, great. Wonderful. All right. So let's start by talking about brain health broadly. So we're talking about brain health. I'm talking about cognition and cognitive functioning. And so you might have heard of these before, but I want to make sure I meet everybody where they are. And so cognition is just generally referring to our thinking process and our brain's functioning. Cognitive, and more specifically, are these abilities to perform skills in all sorts of different areas. So that's thinking, concentrating, learning, remembering, and just doing daily tasks. And so our brain has a huge variety of abilities that it can do, but they're broken down into some of these domains that I was kind of listing before. But some of those main cognitive functions, they're for the most part broken into like language, memory, thinking speed, and attention. Okay, just got some of these tabs. Yeah, so when you think about cognition as brain health, thinking about things we can do to keep our brain healthy so that we can continue doing these cognitive functions as normal. So maintaining brain health can help prevent unwanted or unexpected cognitive decline, because as you'll see in just a second, there's some really, really normal and expected changes that occur with age, but there's some unexpected, more or less usual changes that can occur. And so practicing brain health is one way to prevent or delay any of that. And it's never too early to start. So this should be very helpful, hopefully. So first and foremost, aging is not just a loss of cognitive abilities, unlike you might see kind of that narrative being shared sometimes, wanting to really focus in on breaking that stigma around aging just being, losing your memory, right? Not at all. Our brains are actually plastic, which just means that they continue to change all the time based on our experiences. So, we do have brain development that is really, really important. Our brain is growing up until the age of about 25, but that doesn't mean it just ends there. Our brain continues to change and continues to I guess just change to make, changes. So normal aging also includes cognitive changes. And so some of these things are, there we go, normal and expected, but sometimes there's things that we don't really want to happen. And so that might be what some people have anxiety about. So I want to go through some of these different domains that I'd mentioned, some cognitive domains, and talk about how it's super expected that some things are going to stay the same, while with normal aging, some things we do expect to change. So for example, intelligence. So intelligence is a term that can be misused sometimes, but really it's just how we measure general abilities or your accumulated knowledge over your life. And so crystallized knowledge, which is one type of intelligence, is really things that you learn over time and it just sticks with you. So things like learning to read, right? Like you've learned to read and you can still read probably, right? Or riding a bike, for example. We don't expect that to change. But fluid intelligence, which is our ability to solve new problems outside of what we already know, becomes a little bit more difficult. It just naturally does. And that's it's not problematic or concerning. Memory, big, popular, common one. Memory doesn't always change for the most part, right? So what I'm calling long-term memory, that's something that stays. And I'm just trying to, sometimes the terms used in memory are inconsistent. So I will tell you what I'm talking about here. So long-term memory, these are things that you just remember from a long time ago. So you don't always forget like who people are, how to do certain things, maybe specific memories you have from early in life, right? We don't expect that to just suddenly go away. But short-term memory can become different as we age. It can become tougher to remember new things. The process of learning and remembering and encoding, that all changes as we have changes in our brain occurring. So forming new memories can be tougher, but that doesn't mean that your memory is gone. And kind of with memory is attention. So we tend to be able to continue maintaining focused attention with, across the lifespan. But what can be harder is divided attention or multitasking, which never really actually exists in anybody. But it does become increasingly harder as we age. And so then with language abilities, we tend to stay, our verbal abilities don't really change, but think about times when it might have been difficult to find the word that you're thinking of, right? Like there's words on the tip of your tongue and you just can't find it. And then maybe you get in your car and you start to drive away and then you're like, now I remember it. It's so frustrating. The word finding can become a little bit more challenging, but your language ability is still staying there. Problem solving is similar to that intelligence concept where we can really continue doing the same things that we know how to do, but sometimes introducing new objectives can become more challenging. And the last one I really want to touch on is processing speed. So this is measuring how quickly we can do the other cognitive tasks and other cognitive functions. So the ability to function cognitively, like our brain's functioning, it stays, but sometimes it just takes a little bit longer. It can take a little bit longer to remember something. And that's really, really normal, but it can be really frustrating for people to be aware of that change and feel like something's wrong with them when really it's not. It's an expected trajectory. So a lot of things can impact cognitive abilities, right? So we just talked about how normal aging, normal brain changes can change your cognitive abilities. But there's other external and internal factors that we don't always think about, right? We tend to jump right to like, it's a disease pathology, it's, it's dementia, but there's a lot of things that can contribute to this. And so medications, a lot of medications can have cognitive side effects. So even over the counter, like Benadryl, that can really impact you, and it starts to impact you more as you're getting older. Various prescription drugs can do the same thing. And so as we sometimes accumulate medical concerns that you might have different medications for, the interactions, or all of these things can impact your cognition. And that's just a conversation with your doctor about that, but not discrediting it. That can very well be impacting your ability to think. And others are changes in sensory systems. So if you can't hear as well, if you can't see as well, of course that's going to impact your ability to remember something that you might not have even heard. If you don't hear somebody telling you something and they're concerned that you forgot it later on, well, you never actually heard it. So how could you possibly encode that into your memory? And then also health concerns. So if you have chronic pain, if you have something going on with your health and your physical health that you're attending to, it can be distracting, and you might not pay attention to other things and encode that very well. Mental health also. I apologize, ignore the more on normal aging and dementia, but the mental health piece is fascinating because our mood can really impact what we attend to. We're more likely to remember stimuli and things that we're coming across that are congruent with our mood, or that are more negative than they are positive. So if we're in a bad mood, we're more likely to remember bad things. If we're in a good mood, we're a little bit more likely to remember positive things. But then also with anxiety and depression, anxiety can cause us to be hyper-focused on certain things, and depression can really just dampen how aware we are of other things. Right? So that can really impact our cognitive abilities. So with that in mind, wanting to switch gears and talk about active ways that you can make changes to or do things and build habits to love your brain. So research continues to support that we can reduce the risk of cognitive decline by incorporating some of these habits into our lives. So the more the better. It's never too late. There's no like missed window. And I do want to note too that I've adapted this list from the Alzheimer's Association's 10 Ways to Love Your Brain guide, which I can link to in the comments at the end if you're interested in that. But I've also added some additional tactics in other research, and active because we're active agents in our lives. Okay, any questions before I start jumping into some of these?
I don't think so.
I think I muted everybody, so they'll need to open themselves up.
I have a question, Paige.
Yeah.
I like your slides, by the way. Will we be getting copies of your slides?
Sure.
Oh, I'd love that. Thank you very much. Okay.
Absolutely, yeah.
Okay.
Yeah. So if you guys are going to want that, then you will need to type your email address and send it to us in the chat so we can, because I don't know who y'all are. We don't have any list of people. So you'll need to give us your email address and we will make sure we get those out to you.
Good point. Yeah. Okay. So let's start with what we nourish our bodies with. I know this is old news, right? You've heard it before, that a healthy diet is linked to wellness and health across the board. But incorporating a balanced diet that's higher in fruits, higher in veggies, lower in fat content, but not fat-free, right? None of the fat-free fad diets has actually been shown in the research to be related to reduced cognitive decline. So using resources like choosemyplate.gov is a great resource that it can help you break down based on your demographic, what types of foods you should be nourishing yourself with. I also looked into the research for specific diets, and there's not a lot looking at some of those, like Whole30 or Paleo, anything like that, that are looking at how that's related to cognitive functioning. The only one was the Mediterranean, and then the Mediterranean DASH diet. And DASH is the dietary approaches to stop hypertension. And so those diets, which are really both Mediterranean, which are higher in fish, using fats like olive oil, lots of fruits and veggies, and so some beans, so fewer or less red meat. Those are linked to healthy brains, and so that is, yeah, of course.
I want to let everybody know that we will be starting a food as medicine series of classes in February, and they will be based on that Mediterranean diet idea.
Great.
Thank you for mentioning that.
Yeah. Actually, I was going to mention your upcoming classes. I didn't know it was Mediterranean.
Yeah,
so,
thanks.
Yeah, good plug there. And then similarly is physical activity. So you'll notice that, a balanced diet and being active, I'm talking about here, this isn't new. A lot of it is pushed for cardiovascular and heart health, but they're actually super linked. So taking care of your brain is taking care of your heart, and vice versa. And so regularly engaging in cardiovascular exercise that elevates your heart rate, increases your blood flow to the brain as well as your body, is all really, really wonderful for your brain. So this is one way to prolong vitality too. So it improves overall health, improves cognitive alertness. People report greater life satisfaction, increased psychological well-being, so less anxiety, less depression. And at the same time, it helps you strengthen bones and strengthen muscles, which can reduce your risk of falling, which, skipping ahead a couple tips, is another way to love your brain is by protecting your head and protecting your brain. So physical exercise has actually also been shown to stimulate brain growth. So it helps make neural connections, which kind of taps in again to the fact that your brain can change throughout your entire lifespan. And so this is one way to kind of boost that in a good way. And so exercise doesn't have to mean going to the gym. It doesn't have to mean going and running half marathons. I myself am not a fan of running. It can be anything from swimming to going for a brisk walk, and that is as fast as I like to go, is a brisk walk. But you know what? It gets your heart rate up, and that's what really matters. Dancing, doing housework and yard work, not underscoring how engaging those can be in physical activity. Gardening, if you're able to climb any stairs, or if you have any hills near you, walking up and down those, all really, really wonderful. And then also wanting to note here too that a lot of the community aspect of things like group exercises, that is a little bit tougher right now, but there's ways to also get involved with communities online and do online group exercise classes if that's something you're interested in. It's another way to boost social connection at the same time. So like I was saying, right, there's a lot of the same risk factors for cardiovascular disease as there are for cognitive impairment. So that's things like obesity, high blood pressure, and diabetes. And these can also, the same way they impact your heart health, they impact your brain health. And so when we're having, we're seeing people who have uncontrolled chronic illnesses. And so wanting to pause here and really highlight, I'm saying uncontrolled, right? Because you can have diabetes if you're taking care of it. Generally, you're going to be in a good place. But if you just don't control diabetes, that is linked to another type of dementia called vascular dementia, which increases your risk of cognitive impairments in that way. And so better heart health is better brain health. And so taking care of your heart is taking care of your brain. Right? So just making sure that you are loving your heart, loving your brain with the same thing. So avoiding smoking, eating a healthy diet, physical activity, and going to your doctor regularly and talking about some of these concerns you might have, and just being on top of any chronic health problems or concerns. This next one is continuing to learn, coming to classes like this, being a lifelong student. So on one hand, formal education, so going to school, high school, college, higher education, that is a protective factor against cognitive decline. So it helps reduce the risk of that. And so that can be things like taking a class at a community college, taking them at a community center, coming to free things like this, going online. There's some of the more popular classes from universities like Yale and MIT. They have those courses for free online that you can take. Other universities that are local have free classes for people over the age of 55, 65, I think, but things to look into. But it doesn't have to be formal education either. That's one thing. It can also be reading. It can be taking a less formal class. It can be learning from a friend. It can be trying to learn a new language, learning to play an instrument, really just engaging your brain by learning something new. So whether it's new hobbies, taking an art class, anything that you can do, reading a new book. It can also be just activating your mind by doing things like puzzles, playing games like bridge or chess that really do require you to think strategically. And this has both short and long-term benefits for your brain. So something that you should be able to see pretty quickly. Any questions up at this point? I know each slide is just kind of a new topic, so I want to check in, see how everybody's feeling. Okay, well, feel free to interrupt me. Okay. This is the one that I think so many of us are like, yeah, I know it's important, but like maybe next week. I have things to do, but getting enough good sleep is really, really important for your brain functioning. And so whether it's not getting enough sleep due to conditions like insomnia or sleep apnea, which can both be kind of common, they might actually result in problems like memory, like impaired memory or not being able to think clearly. And so making sure that you're managing those things, especially sleep apnea. I know CPAPs can be a learning process to kind of be friends with a CPAP. They can be really uncomfortable, but getting enough oxygen to your brain is really, really important for your brain health and for your ability to think and remember and do all of those things. So taking care of yourself in that way is going to be a really important way to love your brain. But then also practicing good sleep hygiene. And so sleep hygiene is kind of a weird term that I don't know is used outside of the mental health realm, but it's really talking about healthy sleep practices. So those are things like regular exercise, right? Just not right before bed, because that can kind of get you up and activated. But regularly exercising can really help alleviate sleep problems if you're having trouble falling asleep. Having a comfortable sleep environment, not having a really heavy meal or drinking too much before bed, of course, avoiding caffeine, alcohol, smoking, just being mindful of what you're doing before bed. So this one is also a little bit of like old news, but I wanted to highlight because it is really important to your brain's health and wellness.
I appreciate you highlighting that. I think that verse 1 about screen time is really important with so many of us using iPhones and iPads and computers. And, I think, at least an hour or so before bed, kind of getting off of those and giving your brain a chance to rest and not be so stimulated is really important.
Yeah, and hard. And I'll also take this as an opportunity to acknowledge that it's so easy to just, pop in and be like, hey, here are all these amazing things you can do for your brain. And you're like, yeah, these are amazing. All right. But then, the evening rolls around, you're like, I would like to watch Netflix. I would like to watch something before bed. I would like to stay on my phone. It is really hard to build new habits. And so keeping that in mind, meeting yourself with compassion and giving yourself some grace if you're trying to start a new healthy habit.
And even though they seem like common sense, sometimes we really have to work hard to make it happen for ourselves.
Mm-hmm. Yeah.
So what about reading before you go to bed? Is that considered relaxing?
Do you feel relaxed when you read?
Yeah, it's my quiet time.
That sounds lovely then. Yeah. I would absolutely recommend that.
Okay.
Yeah.
Oh, I have a question. I hope I'm not damaging my brain too much because I'm kind of glued to my Android phone.
Oh, I get that.
I'll see notifications, and of course, some of the things I might see are very unpleasant and very, just what's the word? I guess it's unpleasant. I might see some very unpleasant news or
Yeah.
Anyway, I don't know if I'm really. Of course, I do use electronic devices. I'm addicted to meditation apps. Meditation while I go to sleep.
That's great.
Yeah, it's.
Yeah, that's lovely. That sounds like a really great way to help yourself fall asleep better.
Now, I'm going to ask you something. Is yoga good for your brain?
I don't know about research comparing yoga to other forms of, on one hand, mindfulness and meditation and movement, because it combines both of those together, and both of those are really great for your brain and wellness. So I would say yes. I don't know how it ranks compared to other things,
Right.
but it does combine kind of both of those elements that are both really great. Yeah. Okay, great questions.
Thank you.
Yeah. So this next one is about social connection, which is really hard right now. And I 100% acknowledge that, and I'm right there with you. But staying socially engaged, and a lot of research studies has been shown to support brain health. So pursuing activities that are really meaningful to you, like spending time with your loved ones in a safe way, however that looks right now, getting involved with your community like you all are doing right now, and supporting other people. So volunteering with a local community organization or community center is a great way to really foster some of that social connectedness and also feel a sense of value and purposefulness. But then also spending some quality, undistracted time with a partner or a neighbor or a child or a friend or a parent, whoever is your person, your people, spending quality time with them. It is very easy to, my partner and I were sitting on the couch, we're both on our phones. That's not uncommon for a lot of people. Just putting that aside and spending quality time together. And even now with all of the barriers that we have, staying social through things like what we're all doing right now, video chatting, you can call loved ones. I know a lot of different groups that have started virtual book clubs together. So reading and then jumping on Zoom or calling and chatting about the book, which is awesome. You know, there's the same coffee and pastries vibe, but that's still a really wonderful way to stay engaged.
Yes, and several of the villages do have book clubs.
Oh, that's lovely.
I know
That's
Willow
great.
does. We have one for sure. Yeah.
That's great.
Our village has 3 of them.
Oh my gosh.
That's great.
Yes.
That's awesome. Good for you all. Okay, circling back to medications, because another way to love your brain is to just know what you're taking into your body. So some medications do have unwanted side effects, and those can be a little bit more amplified for older adults, just because of the way that our metabolism changes over the course of our life. And so there's some medications that physicians know that you really shouldn't be prescribed during certain periods of your life. And so that shouldn't be a concern, but there can still be unwanted cognitive side effects in certain medications that can cause feelings of sedation or delirium, right? Like not feeling fully there, foggy brain, sometimes unbalanced and falling. So just being aware of how things like Benadryl, right? Any anxiety, depression medications, muscle relaxants, certain medications for IBS, or other ones, how they might be affecting you. And so just being aware, talking to your physician about that, being really engaged in your care, in your health care, is one really important way to have that autonomy and also love your brain.
Also, just if you have to have any surgeries, sometimes anesthesia can mess with your cognitive abilities also. So just make sure you talk to your surgeon and especially the anesthesiologist.
Yeah, yeah. And I guess I didn't include it at the beginning of this one, but cognitive changes, so cognitive impairments they're not always permanent. So they can look a couple different ways. They can either be progressive, meaning that they get worse over time, which would be something like a dementia or an Alzheimer's disease. They can also be kind of a one-time event where they don't get worse over time. So they're like having a stroke or a traumatic brain injury, but they can also be entirely reversible, which are things like medications. So if your medication causes side effects or you have anesthesia, you might notice after a couple of days or after you stop taking the medication that your thinking comes back to normal. So that's reversible. And then consuming alcohol mindfully. So in addition to increasing the risk for other health problems like diabetes, high blood pressure, heart concerns, excessive alcohol use is linked to cognitive impairment. And so I'm saying mindfully because you know your body best, and having a conversation with your physician about how alcohol might interact with any medications or health conditions would be really, really important. But when it comes down to it, the way that our body metabolizes alcohol, just like with medications, it changes as we age. So it might not take quite as many glasses of wine to feel the same way as it did a handful of years ago. So you start to feel it a little bit more quickly, which can put you at a higher risk for injuries or falls, or difficulty thinking or having some memory concerns. But some research out there does suggest that having some alcohol can be a protector and promote cognition, but there is some conflicting findings and what people are coming up with. So mindful consumption is going to be a really important way to show your brain and heart love in that way. This is another one that would be great to have a conversation with your physician about. So circling back to something we talked about with movement being really great because it can help you build up strength and bone density, is staying balanced and preventing brain injury is really important for brain health, of course. So brain injury can absolutely increase your risk for cognitive decline. So doing things like wearing a seatbelt, wearing a helmet, doing things that you need to do to prevent falling, so whether that's using balance aids like canes, walkers, railings, wall handles, whatever it is you need to do to really make sure that you're protecting your brain from falls. And then when you're walking, being mindful of what you're doing, right? Because distracted moving can naturally lead to losing balance, which can lead to head injury or falling. And so practicing movements like Tai Chi, yoga, like we talked about, stretching, these can all help increase your balance. And Tai Chi is actually had research done with it, has been shown to be very effective in building stronger balance abilities. And then I want to talk about mental health. because
Paige, can I just say, for those, there are several senior centers in the area. I know Tualatin and Lake Oswego are both doing Zoom classes. Sorry about that. They're both doing Zoom classes for balance and exercise and strength and cardio and things. So I'm sure some of the other ones are too, but I know that those two for sure are.
That's great. That's great. Thank you. So,
excuse me,
yeah.
this is Cheryl. Actually, I go by Sherry. Yes, and I do Qigong, which is like Tai Chi. But a couple of years ago, I read in a magazine a simple suggestion, and that is when you brush your teeth, first stand on one leg and, do half of the toothbrush routine, and then switch and stand on the other leg and finish brushing your teeth. And it's so simple, but I think it's really very effective.
Absolutely.
So I'll just throw that out. You have to brush your teeth, so why not practice your balance by standing on one foot then the other?
It works for washing when you're washing dishes too.
Yeah, and what you're talking about is actually a really great technique to build any new habit, because we know like a new habit, a new wellness habit or routine it's hard to just do. So when you pair it with something you're already doing, it's really powerful. And so by doing something like brushing your teeth, like you're not going to just not brush your teeth or not do dishes forever. So when you go to do that, integrating in a new habit like practicing balance. I like to stretch when I'm brushing my teeth. Just building in something is a great way to make sure that that's going to happen, because it kind of works like a cue for you. So talking about mental health a little bit too. Talking about mental health, I had to talk about stress, of course. So stress happens at a couple levels. So it can be acute or chronic. So acute stress is, daily stress, like remembering that you signed up for a class and you're running kind of late, so you're trying to get there on time and get on Zoom. Or you forget to send an email or call somebody you told them you'd call them, so you're feeling a little stressed about it. But when that happens a lot, so when there's a lot of little things, or when there's really big stressors, like a global pandemic, for example, it can have more negative effects on our body and really impact our ability to think clearly, to remember things, and to feel as positive as we did before. So managing stress is really important for brain health. And so just finding ways to take care of yourself and kind of empty out your cup of stress every once in a while to make room for things that are going to keep coming is really important. And similarly is mental health. So mental health things like anxiety and depression. So depression can impede your reaction time to things. It can impede your memory. And anxiety can get in the way of your ability to pay attention to everything going on. So there's a lot of stigma around asking for help. But if you are experiencing mental health symptoms, or you know somebody who is, kind of getting that support is absolutely showing your brain a lot of love. And so practicing regular self-care is another way to do that. It's so much, self-care has become kind of an industry of spa days and bubble baths and things like that, but it's actually rooted in surprisingly taking care of yourself, right? It's in the word itself. It doesn't have to be something that's an expensive trip or anything like that. It can just be going on a walk by yourself and taking some time to reflect or relax. And I realized I skipped over one that I want to touch on too. PTSD and dementia. I just read this a couple weeks ago in a study that people who end up having PTSD is post-traumatic stress disorder. Not everybody develops it after experiencing something really traumatic, but some people do. And if it goes untreated, it does increase your risk for dementia. And so with anxiety, depression, trauma. It's not to say that you're going to develop dementia, just saying that if you take care of it, if you get the help that you need to kind of manage it, your risk does lower.
And Paige, and you are going to do a session next Friday afternoon at 1 all about stress and aging, right? So you'll go more into the stress.
Yeah. Yes, absolutely. Thank you. Yes. Yeah, and then so practicing self-care, we'll talk more about that too when we talk about stress, but also having a positive outlook on aging. Again, easier said than done, but research has found that people who tend to not internalize some of the negative stigma around aging that can be prevalent in some communities and in some cultures, who tend to feel that aging is positive, that it's a good experience, that it means good things, that they tend to have better cognitive functioning as they age. So really internalizing some of that, the goodness in it. And then I apologize, we're not running this currently, but getting baseline testing is also something you can do that's important. And so while I can't offer any free testing right now, something that you can do is when your doctor, when you go to the doctor every year and you're talking about just checking in, seeing how things are going, and he or she says, I'm going to give you a list of words. I want you to remember these after like 5 minutes or so. A good, I'm working in a primary care setting right now, and a lot of people really hate it and they just don't want to do it. And they say, nope, I'm not doing that today. But doing that is just like getting your blood pressure taken. You get your blood pressure taken not because they think something's wrong with you, but just to monitor it. And so this thing that they're doing, it's called a mini cognitive exam, is they're just monitoring it to see if there are changes over time, to check in and see how things are going. So doing that is always a great way to keep tabs on how you're doing. So wanting to put in some local and national resources, you might have a better list actually with villages. I'm not sure, but if you're feeling a little bit lonely or isolated, there is a senior loneliness line and a senior connection calls that you can sign up for. There's crisis lines and aging disability resource connections of Oregon. And there's also some great national resources if you're ever just feeling really lonely or distressed.
Yeah, thank you. We also, I don't know about the other villages, but we have sort of a buddy system where people call each other sometimes, and we also reach out to certain people. So that's part of what we do. So you guys can unmute yourselves now if you want to ask Paige questions. And I love that resource line. We also, on our YouTube channel for WLLO, I used to work for the folks who put the ADRC together, the Aging and Disability Resource Connection. So we did a walkthrough that's on our YouTube channel of how to use the website so that you can find your own, find all the information. Paige, this is awesome. Anybody have questions? She gave us a lot of information, and I know it sounds like common sense stuff, but it isn't really. And when you try to put some of it, like she was saying, into our lives and do it in our daily routines, it's not as easy as it feels like.
Yeah. And I it's kind of weird to do like a verbal citation, trying to give credit where I get some information, but I do learn about it's this field called behavior change and how to integrate in new healthy habits from a podcast that I'll put in the chat that I'd recommend. It's called The Feel Good Effect.
Great.
I don't know if that's a proper way to give a citation.
And it looks like a few more people. Who is the person that you are reading the newest book of his?
Sanjay Gupta.
Oh yeah.
Yes.
Oh yeah.
I
She's
just
so-
got
about
it
that.
yesterday. They have it at Costco. I picked that one up. And the other one I picked up that I've started reading that's very interesting is Melinda Gates. She talks about she and Bill's philanthropy, and I just got started on that. So reading good things.
And Rick Hansen, also, he's a doctor and he writes really interesting books about our brains and how that works.
Rick Hansen.
The Feel Good Effect podcast. Okay.
Yes, and she's interviewed Rick Hansen a couple times on there.
Oh, really?
But yeah.
On behalf of North Star Village, let me thank you for doing this. This has
Yeah.
been very, very informative.
I'm happy to hear that. Thank you. Thank you for coming.
Very interesting. I'm looking forward to next week.
Yeah.
Oh, good.
Awesome. Yes, Paige,
Well,
on
thank you.
behalf of all the villages, we want to thank you for sure. Yeah. And I'm super happy that all of you who aren't at Willow decided to come and join us. I just love the fact that you guys are opening your stuff up to us and we're opening our stuff to you and we get to meet all these new friends. It's great. Any last questions for Paige before we let her go until next week?
Just thank you very much.
Thank you.
Thank you for Eastside Village. Thank you.
We'll
Thanks,
see you next
everybody.
week.
Have a great
Thank you.
week.
Thank you.
Thank you.